Afternoon. My name is Jason McDonald with CDC Media Relations. Today you will be briefed by Dr. Henry Walke, W-A-L-K-E. Dr. Walke will deliver a brief opening statement and then take your questions. Dr. Walke.
Thank you for joining us today. My name is Dr. Henry Walke, and I'm heading up the local team from the Centers for Disease Control and Prevention. We are responsible for helping to ensure the health and well-being of the people the Department of State is returning from Wuhan, China, as well as continuing to ensure infection control and other precautions are followed. The evacuees will be temporarily staying at Travis Air Force Base during the remainder of their 14-day quarantine. I am happy to report their plane touched down safely earlier this morning. There are a total of 178 people on this flight, and they're glad to be here. They've been through a lot, and we're going to do everything possible to care for them. Because these people lived in Wuhan, the epicenter of this outbreak, where there was intense and escalating community-wide spread of the novel virus, they're classified as being at high risk of exposure. Medical personnel have been screening, monitoring, and evaluating these folks every step of the way, including before takeoff, during the flight, and following arrival. This includes checking temperature and observing for respiratory symptoms. Medical screening will continue for the remainder of their quarantine, and throughout their quarantine, we will be following CDC guidance for infection control. Anyone showing signs of illness during the quarantine period will be transported to a nearby medical facility for isolation, evaluation, and care as needed. We know this situation may be concerning to people in the Travis Air Force Base community. Based on our experience with other coronaviruses, we don't believe these people pose a risk to this community because we are taking measures to minimize any exposures. With coronaviruses, person-to-person spread is thought to occur mainly via respiratory droplets produced when an infected person coughs or sneezes, similar to how influenza or other respiratory pathogens spread. These droplets can land in the mouths or noses of people who are nearby and possibly be inhaled into the lungs. There may be some spread that happens through close contact or touching a contaminated surface, but it's not thought to be the main way of spread. The public health measures CDC and the federal government are taking, including this quarantine, are science-based. We're taking this action to help protect the health and safety of all Americans. CDC staff have spoken with the evacuees at Travis Air Force Base. We explained to them that CDC, under statutory authority of the HHS Secretary, has issued federal quarantine orders for all 178 passengers. The quarantine will last 14 days from when the plane left Wuhan, China. 14 days is the longest incubation period ever observed with coronaviruses. This legal order is part of our aggressive public health response and will also protect the health of the individuals, as well as their families and their communities. The goal of our public health response is to detect cases quickly and prevent further spread of this new virus in the U.S. This is the first time in more than 50 years that CDC has issued a quarantine order. While we understand this action may seem drastic to some, our goal today, tomorrow, and always continues to be the safety of the American public. While we recognize this is an unprecedented action, we are facing an unprecedented public health threat, and this is one of the tools in our toolbox to mitigate the potential impact of this novel virus on the United States. Before I take questions, I would like to reiterate that everyone has a role to play as we work together to contain the spread of this virus. Everyone should stay informed. CDC is updating its website daily with the latest information and advice for the public. Additionally, remember to take everyday preventive actions that we always recommend to prevent the spread of respiratory viruses. We have extensive guidance and information on our CDC website. We recommend visiting the site regularly for updates. We'd be happy to take your questions.
Dr. Walke, how concerned should people across the United States be right now?
We think the risk to the American public is low, and that's why we're taking these aggressive measures to maintain this low risk.
Should people be racing out to buy masks?
No, we don't believe it's warranted to buy masks in the general community.
Doctor,
Yes.
in general, who are the 178 people who are here at Travis? Are they business people? Are they government people? Or?
I don't know their occupational background. They are people who were in Hubei province and had this exposure, and they're a mix of people with various backgrounds.
But they're not necessarily government. They're not necessarily government people.
They're not necessarily government people, unlike the first plane where there were a majority or a number of government officials on that plane. Yes.
Doctor, to be clear, so just so people understand, none of these people show any symptoms at this point before, during, after the flight so far?
There was one small child who had a fever on the flight and is being evaluated now at a nearby hospital.
What talk about their day in and day out now existence for the next 14 days, where they're being housed, and the medical provisions being taken now?
Thank you for the question. They're being housed on the Travis Air Force Base in housing that is and has restricted movement because they're under quarantine. There is an outdoor space. Each family has an individual room, and they're offered food and services, wraparound services to provide their comfort. But they'll have to stay under quarantine for 14 days.
So there's laundry rooms on site?
There's
How does that
laundry-
work, so they don't then pass it on to other people that are in that quarantined area?
That's correct. Now remember, all of these people who are under quarantine don't have symptoms, but we're monitoring them. They're maintaining levels of separation or social distancing, but they do have access to regular services.
And who's
Yes.
cooking their food? Who's doing their laundry? Who's taking out the trash?
We have contracted services to do these types of necessary services, and we're also providing guidance on infection prevention and control for this. Yes, please.
How old is the child that had the fever, and then what kind of age range of the 178?
Let me take your second question. The ages range from less than 2 all the way to over 65. I really don't want to get into the details of the specific ages of the child just to protect their identity, as well as I don't want to get into the details of which facility they went to.
Was
What
the
are the
child
procedures?
quarantined on the flight? Separated from everybody else on the flight?
It's an airplane, and so as much as possible, but it is an airplane, and so. But let me just say again, children have fever for a number of different reasons, and so the child is being evaluated at this point, and will be put in isolation and tested.
What are the
Yes.
what are the procedures for, not only to Doug's question about the services provided to the people as they're living or they are, but then also for if someone becomes ill, then what does that protocol look like?
So if someone becomes ill, and so you're aware, we're monitoring their health on a regular basis. We're doing twice daily health assessments and temperature checks. And if someone becomes ill, we'll do an evaluation. And if we feel it's warranted, then that person will be separated from the community and put and sent to a nearby healthcare facility and worked up for tested both for novel coronaviruses, but for other infectious diseases that may have caused the symptoms.
And what does that look like
let me
at
go
the
here.
hospital? I mean, are they quarantined there? Is everybody in a hazmat suit? I mean,
Everyone is not in a hazmat suit. Clinicians and general practitioners all around this country every day take care of patients with respiratory diseases. And these facilities have the appropriate isolation rooms to take care of these patients. Yes, please.
Can you talk about the facilities that you guys have been in constant communication with in case of those evacuees having to be transferred to a nearby facility, as you mentioned?
We've been in touch with state and local public health authorities and have reached out to healthcare facilities to gauge their capability to receive such patients, both adults and pediatric patients.
Dr. Malala,
Yes.
particular patients are not exhibiting symptoms, and how were they selected to first get on this flight and then ultimately end at Travis Air Force Base?
Right, so these are, the Department of State has made the decision about actually who gets on the plane. Their risk is that they lived in, or they had exposure to Hubei province, where there's this intense community transmission of the novel coronaviruses. So these are people with American citizens who have been exposed or lived in an area where there's community transmission of the coronaviruses, and now we're bringing them back.
What about the flight crew? Are they quarantined as well?
The flight crew used protective equipment while they're on the plane, and so they are not being quarantined. Let me go here, then I'm gonna come back to you.
Doctor, you said that these people are very glad to be here and that they've gone through a lot. Can you expand on that? What exactly they've been through in the last coming days, weeks?
Well, you can imagine there's a lot of information and fear about this particular emerging disease. So they had to wait to get onto the flights, and then when they got on and so there was a number of people who want to get on the flights. That was, and this really is the Department of State, who actually got on the flights. But as you can imagine, it's a long flight, more than 11 hours. And because of the unknown nature of this coronavirus, and there's uncertainty, and that creates some stress as well. So they arrived in the middle of the night after a long flight, and so we welcomed them to the U.S. There was applause when they walked through the door. Frankly, it was a very emotional experience having the first family walk through the door. So they were very happy and smiling to be home, obviously tired. They were processed through some screening and passed through customs and given food, and then put on buses and sent to the local housing.
Doctor,
Go back
we're
here.
talking about the 2-year-old who's now in the hospital. Are the parents also with the child, and who's paying for all of this?
I didn't say the age of the child,
Okay,
to be clear. And a parent did accompany the child to the hospital. We don't want to separate the child from the mother.
So they're concerned then that the parent is also exposed or may have it?
The mother, the parent, who was accompanying the child, will also be placed in appropriate isolation in the healthcare facility.
Dr. Walk, can
Yes.
somebody spread the virus without showing symptoms?
We don't have documentation that this can happen. Is it possible? Yes. We do not think this is driving the outbreak. But obviously this is an emerging virus, and so we're still learning more and more every day. The majority of the spread, as I've said, is through droplet transmission and not. Is it possible to have transmission without symptoms? We think it happens very rarely, but I would never say no.
Do we expect more evacuees coming from China?
I'm sorry, I didn't understand.
Do we expect more evacuees arriving from China in the next coming weeks? So what happens after the 14 days?
To take your second question first, after observation for 14 days, and these evacuees don't develop any symptoms, then they will be released and returned, hopefully, back to their communities and families. So we will assist them to do that. And your first question again was?
So my first question, do we expect any more to be arriving from China?
I think that I really can't answer that question. I'm sort of dealing with what's happening today.
Doctor,
Yes.
how soon might you learn that the small child who's in isolation and undergoing testing at the hospital, how soon might you learn if he or she in fact does have the virus or might just have
In the next few days. It takes some time to collect the specimens, send them away, and then get the result back from CDC. But recently, actually, the test itself is being made available. It's been cleared by FDA. There was a press briefing earlier today, and so that test will be pushed out to all public health labs in the U.S.
Is there a specific reason why Travis was chosen other than its location?
The Secretary of Defense chose Travis, and I really can't get into the details of that. But obviously, Travis is a large facility and able to handle these types of passengers.
Doctor,
Yes.
Is CDC recommending masks for doctors or nurses or caregivers just in case there might be a coughing incident? And what are the treatment options for someone who, if they were to develop it, what are the ranges of options?
Yeah, there's infection control practices that dictate the type of protective equipment that would be used in such a setting. Again, these are standard equipment that's being used throughout this country to prevent clinicians, healthcare providers from becoming infected from a respiratory illness such as this. And your second question?
The treatment options, depending on the severity of the symptoms of the
Currently, we don't have a specific treatment for the novel coronavirus. Obviously, we can provide supportive care, for example, providing if someone was in respiratory distress, oxygen, for example, and providing an environment in a hospital where we can provide the supportive interventions that's needed, but we don't have a specific antiviral therapy at the moment. Yes?
How is this affecting life at the Air Force Base? Is it changing any routines?
The Air Force Base is not changing their normal routines. With the assistance of the leadership in the Air Force Base, we've conducted a couple of town halls with the base community to answer any questions.
Doctor, can you talk about the 14-day quarantine period? Why specifically 14 and not 7? What is kind of the knowledge behind that? Is there a specific time frame to where a person should develop symptoms if they do in fact have this illness or disease?
Correct. So the incubation period is that time between exposure and the time a person might develop symptoms, and it varies depending on the person, and that variation might be from early on, a day or two, to up to 14 days. 14 days most people are actually become symptomatic in that first week. And so we're being very conservative in pushing out the quarantine period to 14 days because there have been some people, though rarely, who've gotten illness during that period of time. So a 14-day window makes us, we're reassured that the person is not infected with the novel coronavirus.
You might have already answered this, but how long were they in China, did you say?
These are people that either traveled or lived actually in Hubei province, and there's all sorts of, they have different levels of exposure from months to years.
So within that quarantine zone, is it just going to be CDC employees? Are you going to have some Air Force personnel also in those zones?
We do not have Air Force personnel in the zone. We have CDC personnel as well as other federal agencies, HHS, for example, or the Administration for Children and Families, with assisting the evacuees. There's a question here.
Are all the evacuees American citizens?
The majority of them are American citizens. I don't know. I couldn't say the whole cohort is, for example.
One more question.
Let me get a question here.
About what daily life will be like for the evacuees over the next 14 days. Are there activities planned for them? Can they go to the pool or the gym or social activities, or are they pretty much stuck in their room?
They're not stuck in their room. The housing is that there are common spaces. There's also a large outdoor area. There are kids among these evacuees, and so we have people on the staff who are working to put together activities. We want to maintain some social distances between family units, but at the same time, we're not restricting people to their rooms. So it's a delicate balance. They are being restricted to this area under quarantine. They're not being restricted to their rooms. We are asking them to have some social distancing, more than 6 feet between family units, and not have, for example, kids. We don't want them to share toys, for example, as much as we can between the families. So these kinds of activities. But yes, their mental health of these families and the people under quarantine is very important to us.
What can you tell the public? What can you tell the public to put them on these?